Have you guys ever seen these things? So if we have tennis elbow, lateral epicondylitis, or really anything, these are actually fairly effective tools. It's a good tool for what it's made for. So we can create an eccentric load. We actually have a video on our YouTube channel. I feel like I should go in 3D with this thing, where we show how you can create, an eccentric load on the forearm flexors. We can create an eccentric load on the forearm extensors. This has been a common rehab tool for golfer's elbow or tennis elbow. I don't know if it always has a lot to do with the extensors of our forearm. I think they become the compensatory unit, or we're just manhandling our elbow with our, 9 times out of 10, the short head of your triceps, because we don't have where the engine attaches to the fuselage, right? That scapulothoracic joint is not doing such a hot job with dynamic stability. So Daniel is our wonderful example here. We're having to kind of have him do things poorly because he actually does really well. So I don't want you to think that Daniel has poor scapular stability and then we're picking on his elbow. We're just having him demo for us. So he's actually going to go into a common DNS position, which is a 6-month plank. And just for anybody out there that would want to critique, we're going to make sure it's really good. Daniel's going to bring his hips down. We're going to load him up because this would be a common rehab position. We're going to get that middle finger facing forward because that's our compass. Now, in Daniel, he actually does pretty good. So if we come in on this short head, right, not too much tone, but if we have him really overdo it and lock out, you're going to see him shake, and then we come in here. Well, where all of this attaches is pretty close to where we're going to feel those lateral epicondylitis symptoms. So if we get him down in a 3-month prone position, this is where sometimes we'll regress somebody that maybe their common complaint with the lateral epicondylitis, maybe they don't even play tennis. So it's tennis elbow, but they don't play tennis. What do? They do push-ups, they do pull-ups, and they tend to dominate things around their elbow. So from this position, now we can start to load the elbow, and oh my gosh, it's just like butter right here. These are, or bingo wings, right? Now we got some movement down here, and then what we could do is we could graduate him up with this same feel because now we have a very nice dynamic stability situation around his scapulothoracic joint where his triceps saying, hey, I don't need to work. And then we graduate them back up to 6-month plank or even transitions, which we have a video on that, going from 3-month, where we load the base of the wrist, up to 6-month. So again, if you're a practitioner dealing with lateral epicondylitis tennis elbow, make sure that we're addressing, we're always addressing, no matter what we're treating, the whole kinematic chain. Besides that, make sure we're not just focusing all our efforts down here. Daniel's doing really good. We're making him hold this position. And make sure we're looking at, hey, where could some other maybe trigger points, some stability kind of compensation, some parasitic movement be taking place? And, always address, like I said, the kinematic chain, especially when it comes down to the technique portion. You can take a break there. When it comes down to the technique portion. So if we see somebody that has tennis elbow and we see they're not incorporating that scapulothoracic, thoracic rotation into these movements, it doesn't matter how well they can do rehab positions and movements like this if they go back out and proverbially hit their hammer with the thumb again. So make sure you're always looking at the things they're going to go do out in their natural environment or sport in daily lives. Hope you guys learned something.